and get started. And as they come on or not, that's perfectly fine too. I'm just so happy you're able to join us this evening. In case you don't know me, my name is Vaso Flores. I am the founder and executive director of Lending Hearts. In June, Lending Hearts turned 10 years old, so it's I'm just so happy with what we've been able to do over the years, but even more so what we've been able to do this past year, including discussions like this. So it makes me really, really happy, and I'm so happy you're all here to be a part of it. Before I kick things off, I want to go over just a few housekeeping items. I think probably everybody's familiar with them for Zoom. You're more than welcome to have your camera on or off. We recommend you keep yourself muted, but always feel free to unmute yourself at any time to jump in, ask questions. You're also welcome to ask questions in the chat box below, and I'll help moderate those as they pop up. And in case you didn't see, our conversation is being recorded this evening. It'll be made available on our website and our YouTube channel. So you're welcome to go back and listen to it again, or welcome to share it with others who you think might find it helpful in listening. So without further ado, I would love to introduce our wonderful panelists. First, I would like to introduce you to Dr. Lori Ferguson. Dr. Ferguson is joining us tonight from New York, and she is the Director of Education Development for the Global Healthy Living Foundation. She is a clinical psychologist, and she offers expertise on patient-centered programming and the educational needs that come with chronic health conditions. Her area of research focuses on developing resilient attitudes and behaviors, particularly in times of chronic pain and stress. Dr. Ferguson also writes for patients on websites like creakyjoints.com and has appeared in numerous webcasts and podcasts. And also joining us is my dear friend, WPXI news reporter, Cara Sapida, and she's here in Pittsburgh. Cara has been a very special friend to me and to Lending Hearts over the years. She's been a wonderful advocate for our patients and the families of Lending Hearts. Each year we would have a kite flying event. Unfortunately, we haven't been able to have it the past couple of years, but Cara would always attend with her own beautiful family and engage with everybody and judge our kite decorating contests. And she's joining us this evening as a patient advocate, as she has now had her own experience with cancer, and will be sharing that with all of you. So I would actually like to turn the screen over to Cara now and to kick things off and share a little bit about herself. We were hearing about her wonderful kids in the beginning, but and I don't know why she says she doesn't know where their humor comes from. But go ahead, Cara.
Well, thank you so much. I have been volunteering for Lending Hearts, I think, since the very first year, if not the second year was my first year. So I did the Kites Take Flight. I emceed it since at least year 2, but maybe year 1, when it was at the Riverhound Stadium. And that was when cancer did not affect my life. And then last year I was diagnosed with breast cancer. And I had my last chemotherapy in December. I had stage 2 triple negative breast cancer, and now I'm in remission. And I wrote my thoughts down because that's the only way I really know how to express myself these days. But I did want to say that when Vaso originally asked me if I would do this, I declined because I didn't feel like I was the right person to speak out, since I admittedly struggle greatly still post-diagnosis. But Vaso mentioned that maybe if I was just honest and expressed how I was feeling in an honest way, that would help people. So those are sort of the magic words that I need to hear to think, okay, I can do this, and I can share my struggle if my struggle helps somebody else. So with that said, here's what I wrote about resilience to me in wake of a cancer diagnosis, post chemo, post double mastectomy. So The first thing I want you to know I did is Googled resilience. And the definition is the ability to withstand or adjust to challenges, or even the ability for something to return to its original shape after it has been altered. For breast cancer survivors, many of us have to attempt to move forward after being altered catastrophically. My appearance has altered. I now have scars across my chest, under my reconstructed breasts, on the sides of my body, and in my heart. My hair is growing back into this pixie cut that I dreamed of all through treatment, but it's not comforting me like how I had once imagined. Instead, it's a daily reminder of what I have lost and of how I have changed. I wonder if I'll find resilience comes a little easier when my hair has grown back, simply because I won't have that daily reminder of loss every time I look in the mirror. Only then I'll still be reminded when I step out of the shower and see that my scars remain. And still, if you could magically remove those scars, I'd have trouble bouncing back, because I haven't begun to heal the scars on my heart, because this disease took a friend. Breast cancer stole her from this world like a thief that I don't know how to punish. As survivors, I think maybe we don't know how to mourn the loss of someone we cared about so much and who shared in our pain and sorrows, and frankly, could have been us. I am both a shell of my former self, while I'm undoubtedly stronger than ever. I try my best to live my life with faith over fear, and I have pulled myself out of the fetal position. First I crawled, and now I stand, and soon I pray I will walk with that faith every day. But that would have to include the days that I feel an ache or a pain, and my heart starts to race, and I feel my knees going weak. I feel myself headed back to the fetal position. How many years out until I overcome fear in these scares? Or maybe the answer is never, that carefreeness was stolen from me, and I don't think I'll ever get it back. But I always tell women that you are more than this fight. So instead of desperately trying to heal, I am just trying to remember who I once was. I am a mother first, I am a friend and a storyteller. I'm trying to appreciate day-to-day mundane stuff that Cara, the mother, friend, and storyteller, used to love carefreely, and stuff that other people take for granted, people who have never been altered by cancer. We get a second chance to really appreciate these moments. If the challenge is moving forward, maybe we do that by going back. Maybe this is resilience, catching myself being myself again, and thanking God for it, because I am more than this fight.
Wow.
That's it.
Wipe my eyes now.
That's it, but it was so much. Thank you.
You're welcome.
You've always had a way with words.
Thanks.
Lori, would you like to
Heal me?
step next?
Well, I mean, Cara, thank you. Thank you. That was clearly from your very strong and beautiful heart. So I was asked to speak about resilience and moving forward, and Cara's really illustrated a number of, I think, the pieces that go with it. And the first is, you know, I think in that definition, Cara, the word that really stood out for me is that word adjust. And so there's something in terms of becoming resilient about acceptance and adjustment to what is. And that's a really challenging bar, as you've just illustrated. I think part of that adjustment and acceptance starts where you started, and that is by naming how you feel. You feel anger, you feel robbed, you feel scared, you feel hurt, all those very real things. At the same time, you feel love for your children and gratitude for a day, and you know, the blessing of being able to taste and enjoy food you love again, and even the start of a pixie cut. You know, so I mean, it's that back and forth balance that has a lot to do with that sort of adjusting. And I think the setting the bar for ourselves that somehow we're going to be resilient, that's the big goal. I think it's much more, you know, tiny incremental steps, just the way you described it. And that sometimes it's not just a step forward, it is a step backward or even a step to the side. But what I heard you say that is a really big piece of that is it's also the ability to keep moving a little bit. It doesn't matter what direction, right? Doesn't matter if it's back a little or forward a little or to the side a little, you know, sometimes it's just uncurling from that fetal position, and that's enough. So, I mean, it's part of the resilience is what's enough for me right now at this stage, and knowing that there are a lot of stages to come. Another piece that you talked about that I think has a lot to do with how we sort of can maintain or regain some sort of stability in the mental health is that sense of identity. Who am I now? And first is to say, you know, in some ways, the way I knew myself or understood myself is gone. And in another way, how I knew myself and understood myself is still here. You know, that both things are true. And so and again, for every one of us, it's individual, how that works, right? And for you, it was coming back to, I'm a storyteller, I'm a mom, I'm a friend, I know that about myself. Cancer can't take that from me. Maybe it took some other aspects. And then what I also heard you say is, and I'm a survivor. And now I'm a storyteller in a new way. And I have a heart that is maybe stronger than it was before or in different ways because it's been broken. So I think for each person, that how do we begin to understand or craft our identity? And it's not, you know, it's not a total remodel. I mean, it's an addition, how we're expanding our identities in some ways, and some pieces of them are gone. Some things we took for granted about ourselves aren't there anymore, but there are also new things, but it's a process of growth, which is slow and it's not linear. I think we live in a culture that thinks things are linear. And sometimes I think even the people that work with you think that the treatment is linear or the progress should be linear. And it's not. It's, you know, it's much more all over, and that there's something really beautiful about just accepting that. And it's also, it deepens us. So I want to talk, so identity, you know, resilience is about adjustments, small adjustments, and acceptance. And I started studying resilience because it's a wonderful quality that in psychological terms, it's a state, not a trait. And that means it's not something you have it or you don't. If resilience is a state, it's something you can build. It's something you can nurture and create over time. It's something you can build up. And anyone who's been through cancer treatment, whatever resilience you had has also gotten spent down, because that's the way it works. But then you can recreate it in yourself. And it has to do with habits and practices and attitudes. It's not just one thing that makes you resilient. It's a whole lot of things together. When I talk about this, I often use one of those illustrations of a rubber band ball that has all those different rubber bands, and all those pieces are what make that ball able to bounce and move. It's not just one. So for any of us working to build our resilience, it's what are my practices, or what are my habits, or what are the small ways in which I help myself, I encourage myself, who are the people who add to that, who help and encourage me. No one of us can be resilient by ourselves. You know, we need our community, which is why, you know, this is such a beautiful opportunity to be together. So that's what I'll say for now, so that we can have more of a discussion and a back and forth.
Thank you, Lori. I hope everyone's thinking of some questions or thoughts, but I'll kick things off with a couple questions that were submitted in advance to get things going. One question was, navigating through chemically induced menopause, is it worse than natural menopause? I wanted to make sure that we shared this question that was asked. Unfortunately, this is a question that's beyond the expertise of our panelists today. And best shared with an individual's physician, but I wanted to make sure that we did acknowledge that the question was asked. We're just not able to address it at this time. Another question that was asked is, the global pandemic affected my mental health much more than I anticipated, and I do believe my cancer history or PTSD made everything feel even more out of control. Things that used to help my anxiety, such as going to coffee shops, seeing friends, traveling, have felt unsafe and stressful due to COVID. Have you found ways to relieve stress and anxiety during these very unstable times? And thank you for these questions that were shared.
So Cara, you want to jump in there?
I would just say that I wrote about this in my book. I felt like the people who came before me had this beautiful outlet of meeting with breast cancer fighters together. Like I envisioned them sitting in circles with their bald heads and drinking, you know, coffee that tasted like metal, and they would just like look at each other like, oh, this sucks for you, this sucks for me. And we didn't have that because we went through cancer during COVID. We didn't have that even the slightest bit. You know, I saw people with masks on their face once a week at treatment from afar. You know, I think Vaso knows this. I really struggled with Zoom during treatment because it would make me dizzy. It would make me very dizzy. So I couldn't even have like Zoom, I don't know, meetings. So I completely understand that feeling. It's absolutely awful. I think, and then there's the bitterness factor that, you know, people don't even know how horrible it is to go through cancer treatment during COVID. It's such a lonely feeling. And you want, you know, it's like your natural instinct is to compare what you're going through to other people, what they're going through. And you're thinking, I was very alone during this. So I don't know who submitted that. Maybe if they're here, they might want to talk about it and it might make them feel better.
It was me. I submitted it.
Hi, Hannah.
Hi,
How
Cara.
do you feel?
It's nice to meet you.
You too.
So I actually went through cancer treatment. It's actually been 10 years since my diagnosis. I had leukemia. But I can only imagine how alone you must have felt and others during this time. Luckily, I did not have to be in the hospital or did not have to have treatment last year and this year. But I just think that from, you know, my past experiences, it almost felt that I was reliving some parts again, that isolation and some things that I think I didn't deal with during that time, and it forced me to deal with it during this time. So I just think that, and to what you said as well, a lot of people, hopefully they are grateful to not know what it's like. And I just think that, yeah, it was, and especially I'm 25 years old. So I think a lot of my, you know, my social life too was completely taken during this time as well. So I think it's just, it's been a very trying time for a lot of people, and it's wonderful to have this community as well who, you know, we all didn't experience the exact same thing, but we have an idea and we're able to help each other. And I just think that as the more the time goes on, I'm able to, you know, find more ways, but you know, to not to be as stressed or not be as anxious, but it's still just a hard, you know, unstable climate that we're living in right now. So
It absolutely is. And it's sort of, you know, we're not through it by any means. And I think even though there's less of the lockdown feeling now we're kind of getting the sort of backlash of what we didn't feel when we were in the lockdown. So it's more intense even. Mm-hmm. So what you describe is something that I hear from a lot of my clients right now, that their anxiety is high, their PTSD is high, when they've gone through a trauma, the trigger release. So, you know, you were asking how do you deal with that when you don't have the normal ways? So I'd be interested here, and other people are responding that they've had a similar, you know, what are some of the ways that you have coped with anxiety and worry during this time? Are there any responses from folks around the room?
You mean like other than Xanax?
Well, Xanax is not a bad way to go, right? Medications are certainly a piece of it. I think having conversations like this when you can tolerate Zoom, again, finding any small ways to not feel alone, to remind yourself that, you are moving through it, that sort of positive reinforcement for yourself about what you're doing. Finding a professional to talk to, doesn't have to be a therapist. There are all kinds of ways in which you can find someone to just share with. Sometimes it's just texting, if that's helpful. Finding some way, even if it's a very, I'm not talking about exercise, I am talking about your body, being able to be outside a little bit, even if the environment isn't great, just a little fresh air every day makes a difference. Again, oftentimes you don't feel well, you feel sick. The last thing you want to do is try to drag yourself out the door. But there is something a little restorative if you can, do something like that. Also, the basic breathing exercises, because one of the things that's happened for all of us is the nervous system has gone on high alert all the time, which means our sympathetic nervous system is activated. And when that gets activated, it's very hard to switch over and calm down to that parasympathetic. And the main way to help your nervous system make that shift is through your breathing. And it's to slow it down, to feel it. Also, if you can, when you breathe, let your tongue rest on the bottom of your mouth, not to sort of be up, and to allow yourself to breathe 5, 6, 7 rounds of slow breaths that literally shifts your nervous system from that sympathetic fight or flight back into the rest and digest. And you can do that, every hour if you can, but that does physically calm anxiety. I think, in the season we've just been through, breathing once an hour maybe wasn't even enough. Some people were doing it, in 15-minute increments, just in order to allow that anxiety go down. Because in some ways you had your own anxiety, your own situation, and then we were catching it from everyone else because there was kind of a collective sense of fear and anxiety. I also encourage people to find and name for themselves those small areas where they do have some control. Because one of the things that also kicks this off is this feeling, I don't have any control. I don't know when it's going to end. I can't make it better myself. So to look for some ways in which you do have some small areas of control, if you write them down to remind yourself, I could do this, I can do that. I can choose when I go to bed. I can take a nap. I can choose what I'm able to eat. I can make these choices on my own behalf. Just reminding yourself that that's a way to kind of deal with some of the fear. Dawn writes that she spends 20 minutes in the sun meditating and talking with God, walking by yourself or with friends, clean or a project to help with your anxiety, which is great, Dawn, because that again is putting something that you can control into place. For some people, it was folding their laundry. For some people, it was cleaning a drawer, just one small thing that's like, I did this, and then meds, of course. So other thoughts or feedback about those ideas?
I'm Alia. I have to agree. I think for me, in this past year, I think staying busy where I can, like cleaning. I don't think my house has ever been cleaner than this past year. That helps me to channel some of my anxious energy. Now that my gym is open again, I go there pretty regularly, and it's an hour, if I take a class, it's an hour where it's a really hard class and I can't think about anything else. I can't ruminate on anything. I'm totally focused on just trying to stay present in the class, to keep breathing, to not pass out. It's just a very, because it's so challenging, I have to just stay with it. And I don't have any time to worry about exterior things. So that exercise has helped me a lot. And I, in the past year, I've discovered Amy Lamendola's programs through Lending Hearts. And that's been really, really helpful for me, because I feel like, my cancer recurred last summer, so June of 2020, so a couple months after COVID started. So I had a recurrence of cancer I had in 2015, and I was very traumatized by the recurrence because I didn't expect it. I mean, you're told it can recur, but you think, well, I've paid my dues. I've already been through that. I can close that chapter in my life. I'm done with this. And then it comes back and you just are in complete and utter disbelief. And it was really, really hard for me to come to terms with it's coming back. It was as though, I'd lost, and I've struggled with that this past year, just losing some of my innocence, because I did have an innocence after going through it the first time. I thought I was done and I'd never have to deal with it again. Again, even though I was told, you don't really think you're going to have to deal with it again, and then you do. One piece that I felt like I never, I always, the first time I was diagnosed, I was very shocked because I'd lived very healthfully. I exercised, I ate very well. I didn't smoke ever in my life. I never even did marijuana. I wasn't a big drinker. So, when I was first diagnosed, I was so confused because I did everything that they say you're supposed to do to not get sick. And I still got sick. And, but the one thing that I thought about when I was diagnosed the second time last summer was the one thing I never really did that well was manage stress, or manage my anxiety. And I feel like I've had fairly high levels of anxiety most of my life. I just feel like that's how I've been wired my entire existence. And it's something that I've struggled with, and I do use medication for. But I never really knew what to do to manage it. And when last September, when I had my second surgery, my Basso reached out to me and told me about Amy's programs. And I felt like this was the universe presenting that opportunity to work on that thing that I felt like I never really did all that well. So for me, using Amy's meditations, the recordings on the Lending Hearts YouTube channel are very helpful to me. And I found that just practicing more mindfulness, even if it is mindfulness when I'm folding a basket of laundry, and recognizing what really brings me joy. And I've learned, there's not a whole lot of things that I need in life to feel joy. I don't need to travel to faraway places or anything like that. I mean, I need my back patio and a book and my cats. And I've identified these are things that bring me a lot of joy and a lot of comfort and really lower my anxiety level. And it's wonderful kind of knowing you have that tool at your disposal. It's a beautiful day, go outside, lay on the patio sofa and just read a book for a little bit, or don't read a book, just lay there. And a lot of times I'll just fall asleep. So taking naps has giving myself permission to take naps. Whereas in the past, I found them, maybe it's a waste of time. Now I look at them as very restorative and part of my healthy living plan. So that's for me is, identifying these areas, like you said, where you feel like you do have some control to lower your anxiety has really helped me manage it all, especially this past year.
sounds like you have some beautiful practices that really support you. And one of the things that's so clear in what you say is you've really worked to find what works for you, Alia. You know, it's like, so this is my, I don't have to, you know, do what everybody else says. I'm going to really find what works for me and helps me lower my anxiety. I think that's one of the hardest things. It's sort of like, could somebody just give me the plan and I'll try to follow it? But there's a lot of trial and error in this. Yeah, this particular practice works for me. This one doesn't. I don't want to do that one. I love this one. But the one that you spoke about that there's a lot of research on is that ability to find some joy, even in the midst of hard and fearful times. I saw in the chat box the concern, the fear of recurrence. You know, once you've been through it, sort of like just kind of goes with you. And again, that's part of that re-traumatizing.
And I have to say that's right now. I feel like the second time was re-traumatizing. The first time was traumatizing in its own right because of all the treatment and just the horrificness of all of that. And then the second time was you're traumatized in the sense that now you wonder, well, can it come back again? You know, and there's that fear and that worry. And like I said, I felt like I lost some innocence the second time because I thought I was done, and it came back to get me, and you feel like you've you're not as safe as you thought you were, and that's a very unsettling feeling.
My name is
Only if I
Deborah, and I'm the mom of my son who was diagnosed with cancer 4 years ago at the age of 17. And his treatment plan from the beginning, as outlined to us, was a 3-year process without stopping. Very intensive for the first year. And, you know, when you're hearing this news, there's nothing that prepares you for it, but you're trying to take it all in. It's overwhelming. And they can say to you, this will be 3 years, but you really don't understand what that is like until you live it. And for our family, the 3rd year was just a tremendous struggle. You know, it had been so long, it had begun to feel like it was never going to end. And, you know, when it was over, which was this past December, we were all very, very drained. And my son is now a senior in college. During his first year of treatment, he did not get to go to school for his senior year of high school. Teachers came to our home and tutored him so he could graduate on time, but he never missed a beat. He went on to college and, as I said, is now a senior. But I find that in the aftermath of that, as he has gone off and done a really fabulous job of continuing to live his life, I'm the one who's kind of been left with the PTSD and the fears and just kind of bouncing back from the brokenheartedness that, you know, I've been living with. And in 2 weeks, he will have been in remission for 4 years. So we're really thankful for that. But all of my life, I've been, I'm not like a super crazy high energy person, but I've always been a person that feels like I have to be constructive. You know, like, as you were saying, I'm not a napper. I don't, you know, spend a lot of time pampering myself. You know, I've always, you know, put my family before myself. And I realized that as part of just recovering from this as his mom, it's really going to be about self-care for me and trying to figure out how to define that. Like, what is self-care? Because I have never really taken care of myself. I've taken care of everybody else. And, you know, for me, it's not about like spending the day at the spa or getting weekly massages or anything like that. It's just the little things, you know, like just setting little goals for myself. Like this morning, for example, I said to myself, I'm not going to get up and get dressed and be, you know, on the run doing errands or whatever. First thing today, I'm going to sit on the deck and I'm going to read the newspaper. And like that was incredibly pleasurable to me. And just, you know, kind of learning when it's appropriate to say no and figuring out how to live life, not having 15 more things to do than what I really have time for. For me, that's self-care. And so I think we probably all define it a little bit differently. But it's important to focus on that. And I know when my son was first in treatment, so many well-meaning people said to me, you know, you really have to take care of yourself. And I just thought that is so incredibly laughable, because like I challenge anyone to care for themselves when they're going through cancer treatment, you know, whether it's you or it's a loved one, that's hard. So I'm kind of figuring that out in hindsight, and it's a process, and I'm learning to not beat myself up on the days that I don't do well.
Such a beautiful and important word in that story, Deborah, and that is recovering. And I think about how there's the physical recovery that, you know, you talk about as you're going through cancer, but this emotional recovery as well. And it's all these things that we've been talking about, that shift in, you know, is life safe anymore? Am I safe anymore? That shift in who am I? And there is an emotional recovery to that. And each person will go about that in their own way. But I think your sense of, you know, a little bit every day of what will I allow myself to do and be today is a piece of that recovery, because it's physical, it's emotional, it's spiritual, and it's mental. And I also love the way you sort of have a sense. I think we also have this idea it should happen, it should be done, but it really is, again, that process of it's going to build up slowly over time. The resilience, or we're going to restore our reserves, is how I like to think about it. Our emotional reserves, our physical reserves, our mental reserves, they've gotten really spent. And part of that is the trauma and the shock, and then the arduousness of the treatment. And then we have to be in that recovery restoration time, and the resilience begins to grow out of that. But I think part of resilience is also that sort of what I'm hearing from each of you who shared is some persistence, you know, some willingness to kind of stay with the process as it evolves and unfolds.
If I may step in for a moment, I want to go back to Ollie. It wasn't actually a question that was submitted in anticipation of this evening, but it certainly influenced this evening. Ollie, I hope you don't mind me putting you on the spot, but you said to me one time, and it struck me so hard, that you had said, how do I balance mourning the life that I had before with the gratitude I have for the life now? And I just thought that those were such beautiful words, but so hard hitting, that I hope you don't mind. I really wanted to bring it up tonight, because I do think that it's such a great question that I wanted to pose for this evening and hear thoughts.
It seems that Cara really spoke to that so beautifully in what she had to say.
I ask myself that every day, Ollie. I don't know. It's the big question. I don't know. And I don't know how to not be bitter about it either,
Mm.
you know.
Yeah, it's so hard because, yeah, there's a lot of bitterness there. I've been, the past year has really, I've been really angry. Like I said, it came back and it wasn't supposed to, and at least in my head, it wasn't supposed to. And, and I have a lot of bitterness and resentment of that. And then it stole my, it stole some of my mobility, because where my cancer was, it was in my leg. And this surgery a year ago, it was growing against my sciatic nerve. So they had to cut out that chunk of sciatic nerve, which meant my foot and lower leg went paralyzed. And now I can't walk without wearing a brace. Like, I have to wear a brace to keep my foot at a right angle so I don't trip on my toes when I walk. And I used to run, and I can't run anymore. And if I had to like run, thank goodness my son is 8 and not a little boy where I'd have to worry about running into a street to grab him or something. But I can't do, I can't run through an airport if I'm late, for example. And now I have to wear, and the vanity part of me is a little ashamed of saying this, but now I have to wear this ugly brace on my leg, and it's really not cute at all. And I can't wear flip-flops ever again, or sandals. And, I have to wear tennis shoes the rest of my life. And there's like these like little like stupid things that really bug me. And, it's all part of the anger of it all. And just the real resentfulness that I've got of the whole thing, and the wondering why, like the why, because you just, as I said, I felt like I did everything you're supposed to do to stay healthy, and it got me. And there's such a confusion, and I'll never ever have the answer to it, but it's a question that forever will plague my psyche. And but this, especially this past year, in dealing with the grief of mourning my life as I knew it, because again, I can't, I used to like be like a workhorse, like I could, like, you needed somebody to help you move, I had the muscles and I could move and I could lift heavy stuff. And now I don't have the back of my leg anymore. So I don't have those muscles to help me lift stuff. So I feel weaker, and my balance is not good because I don't have hamstring muscle on my right leg to balance me. So I'm more susceptible to falls. And I often worry about, when I'm elderly, am I going to be this elderly person that like falls all the time? And so there are these things, and in all these questions, they just make me so mad. They make me so angry. But at the same time, then I go, so I'm grieving this loss of life as I knew it, of my normalcy, of my innocence, of my complacency. And at the same time, I know I have so much to be grateful for, because I do have my life. This cancer didn't take my life, and I do have my leg. I admittedly, I worry about that, because sarcomas, which is what I had, sometimes patients have to have their sarcomas often occur in extremities, and sometimes patients have to have those limbs amputated, and I do worry about that, and that's a fear I have now. But I do have my leg, and I can walk. I might have to walk with an ugly brace and wear tennis shoes all the time, but I can walk, and I'm here for my 8-year-old son. So, and I am healthy, and they said they got it all. And I pray to God every day that they really did get it all this time. And so I've got, you know, all these things to be grateful for. But as I said, there's all this grief and mourning that's happening at the same time. And sometimes I find myself feeling guilty for grieving, as though I shouldn't be grieving, as though I should just be happy and grateful for all the positives. And when I'm, you know, what I just I'm finding is I have to allow myself to experience both the emotions, the grief and the gratitude, because those are my feelings and I have to validate those feelings. And the only way to validate them is to feel them. So it's really been, the past year has been this balancing of the gratitude and the grief and the guilt. But I'm starting to push the guilt aside and just let myself feel. Some days I just feel more grief than I feel gratitude. I do. And it's just gonna have to be the way it is on those days. So I think I don't know. I wonder how long this process will take. But it's a slow process, because tomorrow is 1 year to the day of my surgery, of this second surgery I had, of this this recurrence that I had. And it's kind of ironic we're having this discussion on the eve of the 1 year anniversary of my surgery. But I'm really grateful for it, and I'm really grateful for everyone's opinions and insights and thoughts on this topic, because I wish I had more answers. It's just all I can come to is that I've just gotta allow. I remember someone said to me, I think it was actually during my treatment the first time, the only way out is through. And sometimes that's all you can do. You just have to keep getting through, just keep getting through. I remember when I was going through treatment the first time, I remember every day it was just get me through the day. That's all. I hated that, one day at a time. I hated that. I was like, don't tell me that. Don't tell me, because it just makes me feel like there's so many days, But just let me get through this day. Just let me get through this day. And that felt more manageable to me. So, yeah.
You know, Alia, one of the things that you're really illustrating as well is that it's the naming and the normalizing, that there's no feeling that's wrong. Feelings are just feelings. They just come through us. But I mean, the ability to sort of say, what is this feeling, and name it, helps to move it through, and writing about it, or, you know, doing whatever you need to do to let some of that anger or the bitterness or the sadness, but also to make room for the joy. I mean, you can't sort of stop yourself from feeling, because if you stop trying to feel what hurts or what's difficult, you're also going to minimize your ability to feel what's good and what's loving. So what I hear in you is this, and I've heard this from others tonight too, this ability to let those feel them all, and not to minimize. That minimizing or bypassing really just adds more stress. So an opportunity like this to say it out loud, to say what's real. I'm afraid, I'm bitter, I'm sad, I mourn. I also am grateful, and one doesn't wipe out the other. And I think expressing, like Deborah writing a book, what a fabulous idea, as a way to sort of help you sort of identify and really look at and do something creative with the experience. It's a powerful way, again, to name the emotions and be in them. And also what I hear you all doing is also offering up some of your own work on behalf of others.
One thing that no one has mentioned tonight, but is something that I also experienced, is I feel like there was a change in all the relationships within our family, because it was an utterly amazing thing at how differently we all coped with this process. and we all had a different role to play in terms of support and all of that. And so, I mean, that is such an emotional piece of it. And I feel like, you know, that struggle has been a greater struggle than the physical one in some respects.
Mm-hmm. And the struggle was everybody having their own experience.
Just loving each other enough to accept how they were coping when it looked so different than the way I was coping.
Yeah.
You know, because there's a fine line, you know, you can appreciate the strength that someone else has, but you can also hate it. If you're not feeling that, you know, and that's hard.
Yeah.
I have to agree with that. I remember when I was diagnosed in 2015, and I would go to my chemo treatments, and my husband, he would take me there, and it was always early in the morning, like 7 in the morning. And it was such an effort to get out of bed just to go. And I was obviously not looking forward to it. And he would greet the receptionist with, "How are you? Good morning." And I hated that. And I know he was trying to be strong for me, but I hated how cheerful he was being. I just resented it because I felt so awful. So yeah, so I kind of detested his strength. I know he was trying to be there for me, but I wasn't receiving it.
One of the things I love that I'm hearing tonight is also you all are being really warriors for what's right for you, you know? And it's sort of like, this, don't be cheerful with me, all right? Don't tell me, you know, things are all going to work out. I don't want to hear that. This is what I need to hear, and speak up and using your voices. I think there's something really powerful in terms of, you know, not just sort of sitting back and saying, let things happen as they will. But no, I'm going to sort of stand up. Again, that's another way in which we really protect and strengthen our own mental health. It's a beautiful story.
I know we're coming up on the hour now, but does anybody have anything else they'd like to share, discuss? I certainly don't want to cut this off if you have more, but just want
I
to
think
bring
there was
that
one
up.
thing that I wanted to say that reminded me of that in terms of resilience, finding our purpose and finding our voice, and it's going to be different for everybody, but I think that it can really help. You know, for me, writing obviously has like helped me find my purpose through this, but finding my voice was actually pretty interesting too. I think that pre-cancer, I was always just a little bit too nice. And when I was laying there on my sickest days, just to have purpose in those days, I would talk to myself about how I was going to come through cancer and be less nice. I was still going to be equally kind. I found the distinction between kindness and overly nice. And you can lose yourself by being too nice. You stop advocating for yourself by being too nice. And so sort of how people like say they quit smoking cold turkey. I quit being overly nice cold turkey. I promised myself I was going to do it, and so I've done it. And it's incredibly freeing. And I don't think everybody needs to stop being too nice. If you just find something, you know, that you can just do cold turkey because you get this second chance at life, I encourage you to do it. And I want to say it's not even as hard as I thought it would be. But I was trying to think of an example of when I was faced with it recently. And so I'll share this with you guys. I had to take my daughter to urgent care for an ear issue, and the lady behind the counter asked me for my driver's license. And so I handed her my driver's license, and I was waiting, and my daughter was crying, and my daughter was bleeding. from the ear, which is terrifying. And the lady like holds up my driver's license and does one of these. And she goes, "Why would you cut that beautiful blonde hair?" Yeah. Now there was too nice Cara or post breast cancer Cara. And so I snatched it out of her hands and I said, "I did not cut this hair. It fell out because I went through chemotherapy for breast cancer. I will be over here with my daughter. Let me know when it's time to be called back." And I walked away. And I didn't cry and I didn't, I don't know. I'm obviously still bitter about it, but previous Cara would have said, "Oh, I know, I miss my long blonde hair, but I went through cancer treatment, and I don't want to be her." And I think that the way I handled it she will never do that again to somebody.
And again, your beautiful
That's
voice,
awesome.
standing for yourself, Cara. That's just awesome. That's where you can feel your resilience. You felt your strength. You felt your center. That's it. It grows. It grows.
That's awesome. I love it.
That's good to hear. Thank you. Thank you.
But you started, I hope we end on this note, you started with, I think, one of the things the research shows over and over and over again, that having that sense of purpose, whether it's living for your 8-year-old or getting your kid to college or figuring out how you're going to get to the next step in your life that matters to you, that sense of purpose is really what anchors us, and really in a time of anxiety or fear, we can come back to that sort of center point, that lodestar. This is what it's about. And you may lose touch with it a little bit, but again, that sense of purpose is really the most healing and resilient thing that we have in terms of growing our mental and emotional health. So. And Vasa, we are so grateful for your sense of purpose, gathering this community.
You're extremely kind, Lori, but I'm so grateful to all of you being here this evening. Lori, Cara, all of you. This is, we've had various discussions over all these years, but I have to say this one I was really, really looking forward to. I don't know if it's just the time that we're in, but I just feel like it doesn't matter the experiences that you've had. It just speaks to everybody in some way, shape, or form. And I'm really looking forward to us taking the conversation on this down to more specific levels, focusing more on the relationship aspect of things, the employment end of things, just going through all the different areas that we've had to cope through. So, please stay tuned. I really like to see us evolve those conversations, and just truly thank you all for being here this evening and being part of the conversation. So most grateful to all of you. And also, I will be sending out a link, if you don't mind giving me your feedback on this evening and more things that you would like for us to discuss in the future. Really appreciate your feedback to help us continue these conversations according to what you wish for those future discussions. And we're always here for everybody. Whatever we can offer for you, we're here for you. And if there's something we're not offering and you would like, please let us know. So thank you all very much.
Thanks, Cara. Thanks, Lori.
Thanks, everyone.
Thank you.
Bye. Thanks, everybody.
Thank you.
Bye.